Leptomeningitis. It is fragment of brain. You say about size of brain, no, maybe 20, maybe 15, maybe 6, depends on macro preparation. And now, the surface of brain is smooth due to edema and hyperemia of vessels, which are seen from the outer surface. Pia matter is untransparent, yellow-greenish in color, and covers the brain like cap. Enough. Conclusion: purulent leptomeningitis. Lepta means pia-met inflammation. So, when we are talking about hyperemia, we show these vessels. We can say injection of vessel, we can say hyperemia of vessel, we can say any other term identifying overfilled blood vessel with blood. It says about a very acute inflammatory condition there. It will be enough. When it develops, almost it is meningitis, meningococcal meningitis. But without bacteriological examination, we cannot say is it meningococcal or any other bacterial meningitis. Why meningococcal more real? Because meningococcal infection has possibility to penetrate the barrier. Так, это дифтерия. Так, once again, diphtheria there, only this portion. Larynx, there is larynx, and you say larynx is resected, and mucous membrane of larynx is edematous, hyperemic, with dirty grayish films on the surface, partially reducing the lumen of larynx. Conclusion: fibrinous or diphtheretic inflammation of larynx. Is it? So, here we need to say it doesn't there. No presence of these free films line in the lumen. Why? Because different kinds of fibrinous inflammation. There are two, crupus one and diphtheretic one. Crupus on the simple epithelium. In the larynx, you see stratified epithelium. Stratified epithelium, if diphtheretic, fibrinous inflammation develops, it allows very close to bind exudate and subline tissues. That's why it is not separated and closely attached to the wall. Is it? So, how we call this obstruction with this fibrinous film? It is croup. True croup. It is mechanical asphyxia with these separated or not separated fibrinous films. If we are talking about false croup, that is asphyxia caused with hyperemia, edema, hyperproduction of mucous membrane, of visible mucus, and construction of laryngeal muscles. It happens, false croup happens like complication of viral infection, almost para-influenza, sometimes measles. Да? Да, все. Туберкулез.
Туберкулез.
Cavernous tuberculosis. There it looks absolutely different. Here is, you see some cavities. You start like usual. Macro preparation is lung, fragmentum, size, that. Pleura is thick. You see, up to
1 centimeter.
Up to 1 centimeter here. There a little bit less, some millimeters. White, dense, with connective tissue bridges, connecting visceral and parietal pleural layers. It's a result of inflammation, chronic, prolonged inflammation. Parenchyma is irregular in consistency and color. It has some cavities there two big cavities. Here only, excuse me, this one, that one with caseous mass, this one near 3 centimeters, this one it was an apex, no, maybe up to 5 centimeters generally, no, enough for now. There, on exam, there are two big cavities, one maybe 9 centimeters, other maybe 6-7 centimeters. Anastomosis, lung is totally destroyed. But you need to say it is fibrinous cavernous tuberculosis, means with thick wall, connective tissue surrounding wall of these cavities, with caseous mass on the surface, because formation of caseous mass, it is necrotic mass. It happens always in tuberculosis, always, if it is active process. What else? What else? No, maybe enough. You finish. Describe how it looks. Round, not round. Size. So, conclusion. Fibrinous, or excuse me, fibrous cavernous tuberculosis. So, I think will be enough. Last one. Syphilitic, lobulated, segmented, up to you, liver. It is visceral syphilis. Remember, please, visceral syphilis. It is outcome of gummas formation there. I mean, healing of gummas, it is necrosis, Healing happens and formation of connective tissue scar. You remember, scar formation leads to depression, to contraction of tissue. That's why invagination happens in the place. I show you where. You see this depression. Before, on this place, it was gumma. Here was gumma, was gumma, was gumma. Da. When injury is spread, scarring leads to deformation of organ, and you describe liver in size 25, example 2015 multiply 10, surface is lobular, size of lobes or nodes from 1 centimeter up to 3-4 centimeters. Here is a little bit bigger, here is 9 centimeters. Separated with dense scar tissue, or scar, maybe connective tissue, but like to you. Surface, capsule is whitish, thick color, light brown. Conclusion, syphilitic, lobulated liver. So, no?